Alright, the last thing I'm going to do is I'm going to do the cranial nerves on video so I can have it. So it'll be a long one. Okay, so, alright, so first I'm just going to ask her some questions. Have you had any surgeries or trauma involving your head, eyes, ears, nose, or throat? Okay. And any headaches or vision changes? Difficulty hearing or ear pain, runny nose, mouth sores, or throat pain? Okay. Then I'm going to start my assessment. So first I'm going to palpate the frontal, and then the which is right here actually, and then the mammillary, which is right here, with my thumbs. I didn't feel any tenderness or crepitus. Okay, and then I'm going to do the TMJ. So I'm going to ask the patient to open or close your mouth. I didn't feel any popping, any crepitus, no tenderness with that, no clicking and no locking. And then I'm going to assess for jaw strength for cranial nerve 5. So I'm just going to ask the patient to open their mouth against resistance. Okay, so cranial nerve 5 is intact. Now I'm going to palpate the lymph nodes. So this is hard. I know pre's here. Post, submandible, and submental. That's right. Yeah, it's like the oxygen. Yeah, that's right. I didn't feel any tenderness and no masses. Looking at the thyroid, I don't see any goiters. It's in the midline. Asking to swallow. Okay, good. No deviation or anything like that. Okay, so now I'm going to be assessing neck strength, which is cranial nerve 11. So I'm just going to push down as in the shrug. You did. Okay. Then I'm going to do facial sensation, which is cranial nerve 7. So smile, frown, raise eyebrows, and hug cheeks. Cranial nerve 7 is intact and symmetric on both sides. Now I'm going to do facial sensation. So I'm going to grab a cotton wisp and just touch around their face. Cranial nerve 5. Yeah, it's intact. Okay. So now I'm going to be looking at the eyes. Looking at the lids, I don't see any lesions or anything on them. They are equal, no drooping on one side. The sclera are white. The conjunctiva are not, like, they're white, they're not pink. I see brown eyes, black, and there are no lesions, exudate, or pitosis, which is like the drooping of the eyelids. Okay, so now I'm going to be, where's my pen? Looking at the pupils. The pupils are about a 4 bilaterally. Then I'm going to be looking at the symmetry, so they're both around, they're both around symmetric, and reaction to light and accommodation. So I'm doing this. So ask the patient to stare straight ahead. Beautiful, we saw constriction, let them dilate. Do it again, watch the other side. We saw constriction on the other side, consensual constriction, let them dilate. And then I saw consensual constriction on the other side. Then I'm going to be testing for accommodation. Yep, the pupils converged. The pupils are equal, round, and reactive to light and accommodating. That test cranial nerve 2 and 3. Okay, so cranial light reflection is when I'm staring, like doing this, and just making sure that I see it at the same point. So I see it in both eyes at the same point bilaterally. EOMs, so I'm going to be doing the whisker test, so which you just do this. So that tests 3, 4, and 6. EOMs are intact, and I didn't see any nystagmus. That's pretty easy. Okay. Then I'm going to be looking at the ears. The ears are symmetric, looking in them. I don't see any lesions, no exudate. just gonna palpate them, feel around. I don't feel any tenderness, no boginess, and no masses. So, looking at this here, no lesions, no abnormal exudate, and yeah, and no tenderness and no boginess bilaterally. Then I'm gonna do the whisper test. I'm just gonna say it. So I'd stand behind Rebecca. I would say 3 words. She would repeat them. I'd say them in a whispering voice and say them quietly, and she would say them. And if she knows them, then her to touch and feel. Cranial nerve 7, velvet 8. Cranial nerve 8 is intact. Okay, looking at the nose is in the midline. No deviations, no abnormal lesions in there. Looking in the nose, the nares are pink. I don't see any lesions or exudate coming out. Color's pink, condition is good. I don't see any abnormal. Yeah. Alright, and then I'm going to be testing the patient's smell. Cranial nerve 1, olfactory. And I'm just going to pretend like here's, yeah, just verbalize what it is. So now looking at the mouth, I'm looking at the lips. They're pink. I don't see any cracks in them, any lesions or exudate on them. Looking in the mouth, gums are pink, teeth are white. I don't see any chipped teeth, any broken teeth, no cavities. The mouth is moist. No lesions on the tonsils. Tonsils are 2+. Okay, what else do I want to say? No exudate, yeah. No lesions, no exudate, yeah. Okay, so now I'm going to ask the patient to swallow. So I would see the uvula go up straight in the midline. That assesses cranial nerve to touch and feel. Very good, velvet. Heavens. Very good. To touch and feel. Very good. Cranial nerve 9. 9 and 10. And then I'm assessing for swallowing, which I did. Okay. And then looking at the tongue is in the midline, so it's cranial nerve 12. Yep. And you could move. I'll move from side to side. Okay, that's it for that. That's it for CNN. And when I'm doing the mouth, I want to make sure I'm putting gloves on. I know this is it. Make sure I'm putting gloves on, because theoretically I do want to be doing, like, moving stuff around, you know? So just put gloves on when I do the mouth part of the cranial nerve assessment.